Hi, everyone. Today we are going to be discussing the article Putting the Humanity Back into Public Human Management, a narrative inquiry analysis of public service in the time of COVID-19 by Sarah Berry, Maren B. Trochmann, and Judith L. Millesen. This article advocates for flexible, person-centered approaches to public management because people are so important. Public servants deserve celebration for their essential roles in keeping the world afloat during COVID-19. This article will give a view of how people are managing during the COVID-19 crisis. The pandemic revealed increased workload demands and resource constraints while emphasizing a need for human contact. This article advocates for an employee-friendly workplace. Workplace flexibility increases engagement, job satisfaction, and overall employee health and well-being. It is important to give all positions a similar amount of flexibility, not just upper-level employees. For many public employees, telework was not an option, so they had to risk their health. Rules for an effective work environment include standardizing practices so that everyone is treated fairly, humanizing processes to ensure individuals are considered, and evaluating functions to understand performance-based outcomes. The workplace must consider the human needs of belonging, appreciation, and meaning. Part of the process of humanizing employees includes creating a humane and caring work environment that should be less focused on efficiency. The pandemic caused public administrators to rethink how they accomplished agency goals and why they chose public service. To humanize employees, we should also ask how they cope with COVID-19. Public administrators understand unique cultural and regional context that comes with the global pandemic. A study of humanizing employees naturally creates an environment where the researcher would be less of a natural observer. So we have to survey people about how they feel, and that really requires them to reflect on how they feel as a human within their organization. The pandemic blurred the lines between professional and personal identities, caused a lot of people to be working more overtime, more from home. Some important definitions from this article include mechanistic monoism. This is a method in public administration seeking emotionally detached service based on technical, rational, and legal knowledge. Emotional labor is when an individual manages their emotions in order to seek specific emotions from other people. Abandoning emotional labor leads to more turnover, lower job satisfaction, and higher absenteeism. Workplaces should focus on decreasing workplace stress by encouraging reflective thinking and setting boundaries. Reflection on action is recalling prior action taken to inform current action. Mindfulness is paying attention purposefully and non-judgmentally. Temporality is the past, present, and future of people, places, and events under study. The study at hand interviewed 90 public sector employees in different fields, such as sanitation, healthcare, or information technology. The study compares different types of public sector employees, including emergency management, government, and telecommunications. There was not much evidence of significant differences between sectors. Employees generally struggle to maintain work-life balance, but remain passionate through deep public service motivation. Many public sector employees cannot describe a, quote, typical day because each day is so different. Most work is in response to constituent needs on a given day. Public servants usually find their social interactions most meaningful. Many public administrators were so devoted to their jobs that they were willing to sacrifice personal health to continue working. Most were exposed to many people in their professional lives and therefore had to very seriously isolate in their personal lives. Most people describe public service as an altruistic desire to do good, even when it put people at risk during the pandemic. Interviews for this study took place 12 weeks into the pandemic. Employees' time management was suffering during the pandemic. Going to work and then coming home helps with work-life balance, so teleworking sometimes harms that. Creativity to feel connected during the pandemic goes a long way. Many public employees felt guilty for having a job, since many of the people they interacted with did not. Mental health workers said that most people were thankful for their experience working, if they were able. Many felt that classifying some workers as essential and others as non essential was like telling all the non essential workers that they were not important. Most emergency responders and social workers were willing to put themselves in harm's way as part of, quote, what they signed up for. Before the pandemic, self sacrifice may have included working harder with less recognition, but during the pandemic, it included risk to family members' lives. Many problems were exposed throughout the pandemic. Social workers expressed a need for more funding for substance abuse treatment, homeless shelters, and care for elderly people. Most public administrators felt underappreciated. They felt the demands for self-sacrifices were greater than ever before. There was little opportunity for mindfulness for essential workers during peak pandemic, so organizing breaks that institutionalized mindfulness practices would help. Mental health workers led the charge on this, stating that self-care requires constant reflection. Employees need to face trauma and overworked emotional labor to further improve their mental health. In conclusion, the pandemic asked people to reflect on their purpose for their work. The pandemic redefined the concept of essential work. Solutions for humanizing people more in the workplace include institutionalizing work breaks, training with testimony from employees on how they have faced challenges, acknowledging and celebrating commitments to public service, and developing nurturing and trusting relationships between employees and managers. Thank you.